Hey guys, this is Malinki. Welcome back to my channel, Voice of Malinki. Today we will talk about Huntington's disease. And if you are new in my channel, please subscribe my channel. And if you like my video, please do like, comment and share my video. So Huntington's disease is also known as Huntington's chorea. And it is a neurodegenerative disease that is inherited in an autosomal dominant fashion. That means the gene responsible for Huntington's disease is present in one of the autosomes. And it is a mutation which causes this disease. And in order to cause the disease, only one mutant allele is enough, since it is a dominant mutation. Huntington's disease, or you can say HD, appears in a person's 30s or 40s. HD affects 4 to 15 in 1 lakh people of European ancestry. Let's see some causes of Huntington's disease. Mutation in HTT gene causes Huntington's disease. HTT gene is also called the HD gene. So this gene is the main culprit. The HTT gene is located on the short arm of chromosome 4 at 4p16.3. P means it is the short arm of the chromosome, and this is the site of the gene. The HTT gene provides instructions for making a protein called Huntington. This protein plays an important role in nerve cells of brain. Now, part of this gene, that means this HTT gene has a part that contains CAG trinucleotide repeat. That means CAG, 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 CAG like that, which varies in length between individuals and may change length between generations. That means you may have 15 such repeats. I may have 18, just like this. And it can be changed in different generations. Like your father may have 16 such repeats and you may have 15. So, a mutation may increase the repeat count and result in a defective gene. When the length of this repeated section reaches a certain threshold, it produces an altered form of protein called mutant Huntington protein. So we will see the number game now. Normally, the CAG segment is repeated 10 to 35 times within the gene. This is in the normal case. Now, in people with HD, the CAG segment is repeated 36 to more than 120 times. And people with 36 to 39 CAG repeats may or may not develop the symptoms. But people with 40 or more repeats always develop the disorder. And an increase in the size of the CAG segment leads to the production of an abnormally long Huntington protein. The elongated protein is cut into smaller toxic fragments that bind together and accumulate in neurons, and that disrupts the function of neurons, which eventually causes death of neurons. Let's see some symptoms of Huntington's disease. Jerky, random and uncontrollable movement called chorea. Hence, this disease is also called Huntington's chorea. Muscle problems such as rigidity or muscle contracture. So, muscle contracture means muscle gets tightened and shortened. Impaired posture and balance, slow eye movement, difficulty with speech or swallowing. Cognitive disorders. Cognitive disorders mean different mental problems, such as they have difficulties in thinking, reasoning, remembering, imagining, learning words or language. Feelings of irritability, sadness, social withdrawal, fatigue and loss of energy. Okay, let's see some diagnosis of Huntington's disease. First is prenatal testing. So amniocentesis can be performed for an embryo to know about the mutation. Genetic testing, physical and psychological examination, medical imaging such as CT scan or MRI scan. Let's see some treatments of Huntington's disease. So basically there is no cure of this disease. Treatments can relieve some symptoms and improve quality of life. Like movement problem is treated with tetrabenazine. Education and counseling is important. Actually, education and counseling is very important for them since these patients are suicidal sometimes and develop different mental problems. So this is all about today's lecture. I hope you liked the lecture. If you want to get the PDF notes of this topic, please check the first pinned comment or the description box. Thank you.